In this video, we will discuss about the asthma, and we will start our discussion from the definition of the asthma. After that, we'll be talking about the reasons of the asthma, and at the end, we will discuss the pathophysiology of the asthma. So our today's lecture will be composed of the 3 points. So let's start from the very first point, that is the definition of the asthma. How will we define the asthma? It is actually respiratory disorder. You can say it is a disease or a condition in which the airways that carry the air into the lungs and out of the lungs get inflamed and narrow. You know, we have the airways, trachea, bronchi and bronchioles. So what happens to these bronchioles? They get inflamed or they become narrow and result into breathing problem, means then a person feels difficult to breathe in and out. So in short, what is asthma? It is actually the inflammation or narrowing of the airways, due to which a person feels difficult in the breathing. And you know about the breathing, inhalation, exhalation. A person feels difficult to inhale or exhale the air. So that's it about the asthma. Now let's know about the reasons. We have 1, 2, 3 basic reasons. Reason number 1, asthma can be due to genetic factors. Due to genetic means it can be from the parents to the offspring. So that's the number 1. Number 2, it can be due to the medications. Means the medicines that you are using, it can be due to those medicines. Now we have some examples of the medicines like beta blockers, number 1, and number 2, aspirin. And we do have some other reactions of the medicines due to which again you might see the asthma, but these two are the prominent examples due to which asthma can be caused. So these are the 2 medicines, number 1 beta blockers, number 2 aspirin. And number 3, environmental factors can also induce asthma. Now environmental factors include what? Our indoor and outdoor pollution, and it includes dust, allergens and etc. So these all are actually in the environmental factors. Means we can have asthma from 3 very basic reasons. Number 1, genetic. Number 2, medication. Number 3, environment. That's it about the reasons. Now let's come towards the last point. That is the pathophysiology. Here we'll discuss how actually the inflammation and narrowing is going to be seen of the airways. Means how our airways will become inflamed, or you can say narrow. So let's start our discussion from the allergen or any antigen. If it is entering into the body, what is going to happen then? Is the allergen or antigen enters the body, the antigen presenting cell is waiting for these allergens or for these antigens. Now what is going to happen? These antigen presenting cells, guess from the name, antigen presenting cells. These are the cells which are going to present the antigen to some other cells. Now where will it present? First of all, let's do the presentation rule. As the antigen reach the antigen presenting cells, these cells will first of all do the internalization of these antigens. Means this antigen will move into the antigen presenting cell like this. Now the antigen is available inside the antigen presenting cell. Then inside this antigen presenting cells, by means of some enzymes, this antigen will be broken into pieces, and then one of the pieces will be just presented by means of the MHC type 2 class proteins for the T cells. And now due to this mechanism that it is actually presenting the antigen to other cells, this cell is known as antigen presenting cell. Okay. Now when this cell presents the antigen to these T cells will become activated and they will release the interleukins, the interleukin type 4 and interleukin 5. These are released by the T cells. And now this interleukin 4 has got a very big path, and interleukin 5 also. First of all, let's come towards the short path. Interleukin 5 will stimulate the eosinophils. Eosinophils will release the protease and leukotrienes. That's it regarding the interleukin 5. And they are having then the action on our airways, our bronchioles. Okay. Now let's come towards the interleukin 4. And we know about the action of the leukotrienes and proteases. First of all, let us know about the interleukin type 4. What is it going to do? These interleukins, when they are released, they will target the B cells. You can say plasma cells. And these interleukin 4 will do the stimulation, or you can say the class switching of these B cells. You know, our B cells, the plasma cells, are responsible to release different types of the antibodies, IgA, D, E, M, etc. Now interleukin 4, it has got a very important job to do the class switching. means in order to produce only one type of the antibodies. So as interleukin 4 reaches the B cells, it will switch the B cells to produce only IgE antibodies. And now when these antibodies are produced, these will move and will find the mast and basophil cells. After that, they will attach with the mast and basophil cells. And now these mast and basophil cells attached with the IgE are waiting for the second exposure. Now remember one very important point regarding this step. You might remember if you have watched our last lectures in which we talked about the hypersensitivity reactions type 1, 2, 3, 4 in detail. There we told you people that in all the cases in type 1, 2, 3 and 4, in each reaction we are supposed to have two exposures. Means in the first step there will be just a kind of activation of our immune system, and in the second step then the reaction will be seen. So remember this mechanism for the allergic reactions and for this asthma also. Okay, now what is going to happen here? First of all, just these antibodies are produced. Now they are available in this shape, IgE, which is bonded with the mast and basophil cells. Now up to this point nothing will happen. Is the same antigen enters again, means now I'm talking about the second exposure. Remember, according to the mechanism of allergic reaction, in the first phase just the antibodies will be produced, and then these produced antibodies will bind with the mast and basophil cells. Now in the second step and in the second exposure, then the hypersensitivity reactions will be seen, and you can say then the asthma can be seen here, and according to today's lecture. So what is going to happen now is in the second exposure, when the antigen reaches, now in the same person the same antigen is entering again. So it is now second time. When antigen entered for the first time, it produced IgE, and now those IgE along with the mast and basophil cells are available in the body. Now if the second time again this antigen is coming, this antigen will directly have interaction with this antibodies. Now this antigen will interact with the antibodies. So now as this antibody interact with the IgE antibodies, now in the second step it will actually start the allergic reaction, and that will turn to asthma. How? Like, as the antigen binds to the antibody IgE, this will stimulate the mast cell or the basophil cells to release the histamines and leukotrienes. And remember, our eosinophils, they also released the leukotrienes. So now this leukotrienes and histamine, they are actually responsible to inflame and narrow our airways. Consider what? First of all, we have this diameter airway, means having large diameter. As the histamines and leukotrienes are released, these are responsible to activate the receptors. You know about the histamines, we have four types of the receptor, 1, 2, 3 and 4, and the receptor functional in our airways is type 1, H1, which is actually a GQ couple. When it is stimulated, it will start contracting the smooth muscles, and it will start secreting the mucus, and along with that it will dilate the blood vessels. And remember, histamines only dilate the small blood vessels, not the large blood vessels. They actually constrict the large blood vessels. So here, according to our today's discussion, respiratory passage, here it will cause the contraction of the smooth muscles. Along with that, it will increase the mucus, and along with that, it will dilate the blood vessels. And the same mechanism, you can say, a kind helped by the leukotrienes. So leukotrienes plus the histamines, they are actually decreasing the diameter. First of all, we had this diameter, okay, normal airways, okay, the structure of normal airways and normal. What happens when the leukotrienes or histamines are released? They will just start secreting mucus. Here mucus will start accumulating. Along with that, the smooth muscles will contract. So as the smooth muscles constrict and the mucus starts secreting, so what will happen? Then the diameter will decrease. Now here is the case of the asthma. Now the diameter became this short. So first of all, we had this diameter. Now due to the mucus secretion and the smooth muscles contraction, we got this short diameter, means now actually the airways narrowed. So now what happened due to the release of the histamines and leukotrienes? They narrowed the airways by means of the constricting the smooth muscles and releasing the mucus, due to which the airways became much narrow, and that narrowing of the airways resulted in decrease in the passage of the air in and out, okay, and that resulted in breathing problem. So that's how in asthma actually a person feels difficult while breathing. And one very important point remaining is that proteases. Now what is the function of protease? These are actually responsible to do the tissue damage in the chronic cases. Okay, we have asthma when it is acute, and if this asthma aggravates, means it is turns to the chronic, in that case the tissue damage in the airways is actually due to these proteases. And that's it from my side regarding the asthma. I hope you got, and if still you have any kind of question, please drop that in the comment box, and thank you for watching.